and professionals in general. And we had a total 122. This made it easier to think if what we was something that the user would use. In this survey, we found that among 50% of those surveys that will download the app that would be useful and perhaps would download it. So 80% of the target population was interested in this app. So explaining the concept and with the okay from the end user and with that survey of user perception, we made progress in the development of the app.
Eso se trabajó primero en los casos de uso. Para eso
so we worked first on the use cases, and there it is important to determine who was it targeted to. Well, the healthcare team and the caregivers. What for? Why? Well, first of all, we want them to learn about diagnosis, symptoms, so that they can seek information of good quality very quickly. One of the things that we've seen during the pandemic is that WHO has proposed the concept of infodemia and how poor information has a negative impact on health. And then we have what, where, and where. So the idea is to have text, images, videos, audios, because of course you can use, make the most of the multimedia tools that we have thanks to ICT. And then when, it should be omnipresent. That is at work, at home, during office hours, while people were traveling in their idle time where they could have access to the information. That helped us think of the application of the app together with all the team that gave us the support at CLAP. And then when, that is not to have everything mixed, but dividing them into antenatal, then the preterm, and then week after week, the first 28 days. This is the use cases helped us develop the apps. So as you see here, there are different stages. The point of departure was some mock-ups that were quite basic, quite raw, but then in the design, the testing, and then finally in the agreements with the users, we get to the final setting, the final version, both with apps for Androids or with iOS. Why did we plan to work with an app in a mobile phone? Well, mostly because we already know that not everyone has a computer, and everybody, of course, has access to a mobile phone. It's an app that doesn't use up too much of the memory. It uses web resources, and if there's poor connectivity, still you can access different types of information. So this was mostly to tell you of all the different steps we went through when developing this app. So now back to Pablo, who will tell us what the app is all about. Thank you, Paula. So going on with this, we wanted to share with you how we thought of the name, because this was also an important debate, together with the aesthetics that we try to harmonize and we are careful about. eCBB, of course, refers to the e-healthcare concepts for babies, e-salud, cuidando nuestro bebé, easy babies, etc. So the idea is that the name itself may already give you this feeling of the care we want to promote. The app is available both in Google Play, the Google Play platform, and in the Apple Store. So the mobile phones that work with either platform, either Android or iOS in the App Store, may have access to the app and download it, as we'll show you now. But before we go to that, once you download this into your mobile phone, you'll see the home page that will send you to this second. Here you have general information, and but it also has thematic groups, and the contents are all in order based on those axes or thematic groups that arrange the contents. Right now, what you see here is the Spanish screen, and here you see the general the contents that are already there in English, and then we will increase it in the different languages, each content with their images, with the links to support documents. They're all going to be available in the different languages. As we said, this is an app that is devoted to families, to caregivers, but also to the healthcare teams. So the various topics and thematic axis, here you see that this is not the complete list, and it will be further enlarged as contents are gradually incorporated. So we're going to have a differential development and approach at different depths, depending on who is accessing it, whether it's a family or the healthcare team. But of course, and this for us at CLAP and from PAHO, we believe that this is just a point of departure. This is the kickoff of something that is nothing but the beginning. It's going to imply an ongoing work, a permanent work. And in terms of the future, it will imply, and we are fully committed to this, to always update the content, and if there's any novel information, either in terms of technical documents or the scientific aspects or more general data, everything will be uploaded and updated on a permanent basis. And all the contents, we also believe that it's a very important value of the app. And everything arises from the evidence that PAHO and WHO provide and support. So that value of data-based information that is supported both by the institutions and it also is evidence-based and scientifically based, that enhances the worth of this app. As we said, the content will be gradually expanded, and we will make it available in English, French, and Portuguese, in addition to Spanish, and something that we consider that is essential, and that is why we are having this session to launch this, but also we want this work to go on. We are interested in strengthening it and disseminating it and making the necessary changes as we go, and PAHO foresees those stages. Dr. Otero mentioned that there was an initial assessment from the point of view of the users of the contents and the way that it was presented, and it's also we also foresee mechanisms for evaluation at a country level to include different cultural and local issues, so as to constantly upgrade and improve the content so that they will meet the needs and the demands of the entire region, because we know that it's a very heterogeneous region, so they have different needs. So from the point of view of PAHO, we want this to be good and useful for everybody with an equity perspective, and we want this to be useful for everyone. And that is why receiving comments, your feedback and your input, and of all the users, and the app also gives the possibility of sending questions or comments. And so that feedback and the ongoing improvement of the tool will end up in the results expected. Of course, we are all experts in the QR codes. Here you can see the appropriate QR for downloading, either for the Apple devices or with the Android devices. So right now you can already download this app in your mobile phone, so with this QR, and you can start using it, disseminating it. But especially we want you to spread the voice of this instrument, that we believe that in the current context of the COVID-19 pandemic, and given the constraints that people had to access information and care, but also, as the Deputy Director of PAHO mentioned at the beginning, today technology and the commitment of PAHO implies moving forward in that aspect. So we believe that it's a new way we can provide technical cooperation and reach the healthcare teams and families and caregivers, as we said, based on this perspective that we designed this for. So thank you, and thank you for your attention. And now I give the floor to Dr. Sarruya. Thank you. Thank you, Pablo. My congratulations to you and Paula and the entire team of the Italian hospital. I don't know whether you can all see this. I'm going to ask for something strange. I don't know whether you already got the QR, but if not, take your cell phones, look at the App Store, and look for it and download it. It takes nothing. I just did it, and I couldn't even count a couple of seconds. It was so fast. So please, all of you there, take your mobile phones, download the app, and make it available there in your phone so that you can show it to people. Most of the people who are listening, I saw that many people in the chat have already downloaded it. That's what they're telling us in the chat, and they've told us that it's been easy. And yes, precisely, Pablo, that's what we want. We want you to download the app. Now, once you download it, then you'll have all the screen that makes it very easy. It's very user-friendly. This presentation will be in YouTube in 3 languages, Portuguese, English, and Spanish. And you can, and for us, this is very important, to search through PAHO and to forward it to those people who couldn't be with us today. And also, and I feel like a YouTuber, please put a like, because that's important for us, because we are disseminating a product that is very important for the health of children at a key stage of their lives. And it's free of charge, and it's very important for people to have access to it and everybody to know about it. An important thing of the app, of what we hear today, is that one of the first things that Pablo said that I love, when we thought of this, initially, we thought of something that would cover that period, but not just the care, but care with love, lovingly. That's why the campaign is called Loving and Caring, Caring and Loving. So every day in February, we'll be talking about one of the interventions, one of the pieces of evidence that are important. It's also important for you to know this material, and it's going to be of great help. Now, it's very easy in a perinatology visit to tell the mother, the father, the family. If you still have any doubts, please download this app, and at home you can read this at ease. And a lot of things have been added. There's a technical guideline showing how we uploaded this to Google Play and Apple and App Store. And we are going to answer the question because we're going to show it's a long question, but everything that all the steps that were taken so that that may be of help to people who have developed these apps, because these apps that are free of charge, it's good if we can disseminate them and everybody can use them. Now, Pablo and Paula, I have a question, and I think this is something that people sometimes come in when it's already started and wants to ask a question. I think, Pablo, that it would be important to debate the types of users, or how do you enter the app and what kind of training you have. And there, I think that both Pablo and Paula and myself at the center, we want to hear your feedback. For instance, if you say, well, I have the app, I have a suggestion, I loved it, that's what I'd like to see. Or you could say, well, I'd like you to also include this or that, or to present this way or that way. But now I'll give the floor to Pablo so that he can tell you about the type of users of the app. Go ahead, Pablo. Thank you, Suzanne. Yes, indeed. As we mentioned, the primary beneficiaries or users will be, first of all, the healthcare team, and on the other, the families. So we've tried, and we can will tell you when different contents are entered, to tailor the language, the type of information, the support docs for each case, so that the families may find the material in a language that suits them better, but also covering the same topics that are considered to be the most important for the healthcare and care in general of newborns. So when you enter the app, you will be asked to say what kind of user you're going to be, and you'll be able to have that information available more adequately. And as a matter of fact, as Dr. Paulo Otero mentioned, and Paula, I can also send you some more comments. You'll be able to move forward in the app. In the process of consultations, when we were asking people for their feedback when developing the app, we listened to the comments both by the healthcare professionals and the families, some of which were the two things. So we could have a more comprehensive view. Well, I hadn't said it. Thank you, Suzanne and Pablo, for this opportunity. Yes, I went through it very quickly, but in the first survey that we conducted, that was just to see the temperature, the feeling of whether the app would be useful if it included certain things. So with that 80% response, we can start. But I wanted to rescue what Suzanne said. The app, it has no raison d'etre unless the users feel it their own. So it's very important to hear the feedback and the suggestions of the users, what to keep, what to drop, what to incorporate, so that users may find it as a tool that is useful in both sides, by the caregivers and the healthcare team. So this first version was in Spanish, but we must see the translation of the contents and incorporate, and of course, it's information that has been validated and curated by CLAP, and that gives an added value, because you could have an app, the same app, with data from different sites in the web, but who can ensure that that it's good quality data? And it's and CLAP and PAHO is responsible, and we need to make sure that the data has been validated. So the work ahead is much more significant. Here there were people who were asking how they could help. Well, you are welcome. And I see that the people in obstetrics also want one for obstetrics. Well, I think that this is the first step. And as Suzanne said, CLAP already covered the most difficult part. We went through all the steps for not just to develop this, but also to be approved in the App Store and in Google Play. We had to meet some requirements, but finally we made it. It was not an easy task, but we managed. So I think that somehow they're going to be able to guide all the different initiatives. Thank you, Paula. And thank you, Pablo. Laura Alvarez, we already have one for pregnancy that had a stage where we had the vocal points. We wanted to understand the doubts women had. Of course, you could ask the women, and with women, we found that it would be very important to include that initial stage. It's about ready.
O sea, vamos a tener una...
In other words, we will have something that won't be called eCBB because it won't be for babies, maybe EC Mama. And the idea is to consider mother care throughout pregnancy. There are some contents we're considering, such as a postpartum period for the mother in the same app. There are questions in the other languages. I think Paulo mentioned it, but I'm going to hand him the floor. And another issue has to do with milk banks, mother milk banks. The mother of a 30-year-old baby that even as a physician had many doubts about breastfeeding. And it has been wonderful to have questions from friends and people helping me to discuss this throughout a year. And the issue of milk banks is something that we have in Brazil. We have this institution that's a reference agency for WHO in this area, and where we have a lot of over breastfeeding or on breastfeeding, sorry, and how to help the mother. And in the end of the consultation, when we end the session, we can say, maybe you can use this app. And then I hand the floor to Paulo to refer to the questions made in the different languages. And as you all know, in the region, we have 4 official languages: Spanish, English, French, and Portuguese. We'll do it in each of these languages. Of course, there's a time issue, so we will have it in all the languages. Paulo, do you want to complete this information? Thank you, Suzanne. Indeed, as Paulo Otera said, the first development was in Spanish. At present, all contents you're currently seeing in Spanish have not yet been made visible, but are in the English-speaking platform. So the idea is just to have the IT developments to make it available in the near future. We're quite sure that all the information is already available in Spanish, be available in English, and so on, to gradually increase contents in other languages. The information is now in Spanish and in English, and we think English will be completed in the near future, and then the French and Portuguese, and then automatically every content uploaded to the app will be uploaded in the 4 languages simultaneously, so that we won't have this delay that, of course, was because of the initial development process. But I think it's quite imminent. Thank you, Pablo. I wanted to show you another function of this app that is for you to contact us. I observed that of course, you're all complimenting us, but you must also include other suggestions, sepsis, whatever. So please write to us. It's very important to us. We started with what we considered more necessary from the standpoint of what mothers need, health professionals need, be it caregivers, nurses, or whatever. And from then on, increase the contents. It's very important to have this in a PAHO app. In the Latin American Health Center, that you can trust in 100%. All that we have included has the best evidence available, and that sets the difference from other apps. We didn't have an app for the initial 28 days, and I'm sure that all those who had the experience of pregnancy and motherhood know that that period of the first days with the baby at home, even when it's the first that is more difficult, raises many doubts. So we have this content in this app that makes it possible for anybody to consult and write within the app. So if you search, you will find contact, because at first it says who we are in the home page, clap, and the contact possibilities, and you'll have this email that you can click on, and we will receive your queries, and this will help us to be more aware and better respond to different issues. There is a specific subject that I believe is of great importance and we must take into account. And I think that Pablo may further develop what has been done in relation to the 28-day campaign, showing how we proceeded when there were queries or doubts. We have frequent queries or doubts. I hope you have been able to download the app. A question that often arises, a very common one, well, I'm not going to refer to vaccines, but how to wash the clothes. But Pablo, you can choose whatever you please. You're a neonatologist and pediatrician. What was a question that was more frequently made by parents in the office before ending the consultation? The floor is yours, Pablo. Thank you, Suzanne. I think that if we consider the issue of the newborn and his or her growth during the life course and all that, clearly breastfeeding and how to start and the challenges entailed, particularly in the initial hours and days, is a central matter that in PAHO and CLAP we really appreciate. And the issue of breastfeeding and all the different contents to promote, support, and commencement and maintenance are key issues both in the app and in the 28-day campaign. In the chat, there were questions if there was any mechanism to report the breaches in relation to the code of substitutes, but that isn't included. But yes, we have mother support for early breastfeeding, and everything regarding the 10 steps will be included in the app. We'll deepen further gradually in each of the steps promoting this for the health team, for family and caregivers, and the role and place and queries and mechanisms, because indeed mechanisms for reporting and surveillance and specificities or particular things that entail different situations in different countries, to provide support, information, and recommendations. But once again, prevention of infections, baby birth, and many other aspects that are basic and common, but as Suzanne said, particularly with the arrival of the first baby in the family and home, generate doubts. So the idea is to approach each of them to contribute to the aim as proposed. Thank you, Pablo. I want to show something more for those who have downloaded it. When you go to some topics, you will see something described as a source of information. And when you touch that, you'll have the publications available in PAHO that may be downloaded for professionals who wish to deepen further. And this app somehow is for health professionals also, of course. They will really enjoy it. But we have this repository of the best and updated publications available today. And this is easy to say. Well, where did I read that? In this app, you're going to find innumerable citations from the best and more recent publications. We're nearly reaching the end. We have a video, but before sharing it, I would like to say something we always discuss at CLAP, and I think is essential, the future. And we had to think about the future during the pandemic. We will have to invest in self-care. Self-care is the most powerful innovation. If somebody knows how to take care and feed him or herself, and do the same to in relation to the baby and pregnancy, our next step, they will be happier and have a more healthy life. So innovation is equal to self-care, and self-care requires information, quality information that we can really trust, such as that provided by PAHO. So now, close to the end, we only want to thank all those who have participated, our director, Andrés de Francisco, the director, Dr. Mary Lou Valdez, Pablo, who is the mentor of all this activity that has been conceived by our regional advisor. And of course, he represents this great team that managed to create this app. The application is for you, it's yours. So please download it and share it with colleagues. Make it be useful to all. I also want to thank the rest of the team behind the scenes. We have translators, people coordinating support, Ignacio and Ana Artigas, that coordinates all the things at the center. Thank you for being here. Let's see the video. Hope you enjoyed. Thank you. we're not being able to hear the video. We don't have the sound.
Tengo que anotar cuánto le di,
I had
cuándo
to
le
write down how much I gave the baby and when, and also the vitamins.
los primeros 10 días.
Well, you have the subtitles there.
Recién nacido, yo le di su tetica y pues así como la mía está gordita y hasta el momento sigue tomando su lactancia, su leche materna.
Lahnaneu y Ischel y arre van a significar juntir chuein y cher las nuevas en familia, ya que también arre ya una oportunidad che ojo hunan uta y ruk arre shakrak y ojo su y shik hunakan.
She was born premature. We saw the immediate benefits of breast milk. She had no infections. There were no complications. She was able to come home with us.
Borja, mi bebé, llega a una familia monoparental, pero con muchos primos, muchos tíos, muchos abuelos amorosos que estaban deseosos de que llegara y no se encuentran palabras para algo tan inmenso.
Nos dio COVID a mí y a mi mujer, pero había que estar al pie del cañón y levantarse de la cama con 39 de fiebre. Lo que a mí me demostró el nacimiento de Martina, el contexto, es que el amor por una niña genera fuerzas infinitas.
Foi o dia mais feliz da minha vida, mas também foi o dia mais preocupante da minha vida. Eu tive vários cuidados em relação à pandemia. Eu só permitia visitas a pessoas mais próximas mesmo da família.
Desde que llegó Lucas me cambió la vida para algo muchísimo mejor, me enseñó a luchar más por todos mis sueños. La verdad que yo llamo la maternidad como algo, una experiencia caóticamente hermosa, algo que te cambia pero es para mejor siempre.
Pues sí, qué manera él pueda crecer más sano, de una manera que nada le afecte, pero creo que lo voy a ir aprendiendo poco a poco.
Fue como una nueva oportunidad que nos daba la vida para dar y para recibir amor. Ese motor nos llevaba a seguir formándonos para hacerlo bien.
No tenía leche al principio, ¿no? Y cuando ya empecé a tener la leche, pues el bebé, como era prematuro y chiquito, no tenía fuerza para succionar. Hasta que al 5.º día empezó pues a agarrar un pecho y al 10.º día el otro pecho, que eso ya fue un alivio para mí.
Como que el cuidado más importante que he tenido es traspasarle toda la tranquilidad y el amor del mundo. Mudarla, hacerle cariño, darle comida, preocuparme de que su piel esté suavecita, pero principalmente de darle amor.